Welcome to this explainer. You know that awful feeling when you wake up and swallowing feels like you're literally trying to swallow crushed glass? It is absolutely miserable. Well, today we're going to decode everything you need to know about strep throat. We're going to talk about exactly how to spot it, how the testing works, and most importantly, how to fast-track your way back to feeling like yourself again.
So, to put things into perspective, the CDC reports that Group A streptococcus causes up to 5.9 million outpatient visits every single year in the US. That's a massive number. It basically means that if you or your kid are dealing with a horribly sore throat right now, you are definitely not alone. It's super common for kids between 5 and 15, but trust me, it absolutely impacts us adults too.
Here's our quick roadmap for today's explainer. We'll figure out if it's really strep, look at getting answers fast, discuss the antibiotic cure, map out your recovery timeline, and point you toward getting tested today.
Okay, section 1. Is it really strep or just a stubborn common cold? Knowing the difference is a huge deal for how you treat it.
Think about the last time you had a viral sore throat. It usually brings along the whole squad of annoying symptoms, right? A cough, a runny nose, maybe some pink eye, and it builds up slowly. Strep is a completely different animal. It hits you like a ton of bricks, with a high fever, extreme pain when you swallow, and this is the major giveaway, absolutely zero cough. If you're coughing a lot, it's probably just a virus.
If you're running a checklist, here are the classic signs. You're looking for that severe, sudden pain, maybe a fever of 101 or higher, and some body aches. Go look in the mirror right now. Do you see red, swollen tonsils? White patches? What about those tiny red spots on the roof of your mouth? If you've got those symptoms and tender lymph nodes on your neck, there's a very good chance you're dealing with strep.
Moving on to section 2, getting answers fast with the 10-minute rapid test.
This part is a real game changer because you don't have to wait around in pain guessing what's wrong. The provider just does a quick swab of the back of your throat, they run that sample through a rapid antigen test right there in the clinic, and in literally 5 to 10 minutes, you have a highly specific answer. If it's positive, you get your diagnosis and start treatment before you even walk out the door.
Now, what if that rapid test is negative, but your throat is still screaming and the doctor still suspects strep? Well, they've got a backup plan. They can send a highly sensitive throat culture out to a lab. It takes about 24 to 48 hours, but it's the ultimate confirmation, just to make absolutely sure nothing slipped through the cracks.
Section 3, the antibiotic cure, and your fast track to feeling better. Remember, we are fighting bacteria here.
Penicillin and amoxicillin are kind of the gold standard for strep. Fun fact, Group A strep bacteria has never actually developed a resistance to penicillin. Amoxicillin is usually the go-to for kids because, let's be honest, it just tastes better. But hey, if you're allergic to penicillin, no worries at all. There are fantastic alternatives like cephalexin, clindamycin, or a quick 5-day course of azithromycin that'll knock it right out. Okay, listen up because this is absolutely crucial. You will probably feel amazing after just 2 or 3 days on meds, but you have to finish the entire bottle. If you stop early, the surviving bacteria will multiply, and untreated strep can lead to really dangerous complications like rheumatic fever, kidney inflammation, or some incredibly painful abscesses. Seriously, finish your meds. Let's look at section 4, your recovery timeline, tracking what to expect day by day so you know exactly what's coming.
It usually follows a really clear pattern. Day 1, your fever drops, but your throat will probably still be sore. By days 2 and 3, the pain drops dramatically and you start getting your energy back. By days 4 and 5, you're pretty much back to normal. And then days 7 through 10, you're just cruising along, finishing up that vital antibiotic course.
Which brings up the million-dollar question, especially if you have a job or kids. How long are you actually contagious? It is wild how much the antibiotics change the game here. If you don't take medication, you are highly contagious for 2 to 3 weeks. But with antibiotics, you're clear to go back to work or school after just 12 to 24 hours, as long as your fever is gone. Oh, and a quick pro tip, make sure to toss out your toothbrush and get a new one after 24 hours on medication.
It's really interesting how strep presents differently depending on your age. Kids will often get unexpected symptoms like a stomach ache, throwing up, or even a weird sandpaper-like rash known as scarlet fever. Adults usually get milder symptoms up front, but we actually face way more severe complications if we ignore it and leave it untreated.
And a quick heads up for any parents watching, sometimes strep just keeps coming back, bouncing around the house. If your kid gets strep 7 or more times in a single year, your doctor might suggest having a chat with an ENT specialist about a tonsillectomy to finally break the cycle.
Finally, Section 5, getting tested today with Mederi Urgent Care. Look, you really don't have to wait out this kind of pain. Mederi Urgent Care offers walk-in rapid strep testing and same-day antibiotic treatment. You don't even need an appointment. They're open 7 days a week from 9 a.m. to 9 p.m. with 4 super convenient locations across Los Angeles. Plus, they offer comprehensive pediatric services, so you can get relief for your little ones today, too.
Thanks for joining us for this explainer. We've covered a lot, from spotting those classic symptoms to the absolute importance of finishing your antibiotics. I'm going to leave you with this thought. If your throat is on fire right now and you've got a fever, why endure another day of misery when guaranteed relief is literally just a 10-minute test away? Don't wait around. Go get checked out.